All right. So good afternoon, everyone. For those who do not know me, my name is Brittany Rosario. I work at Baystate Health as the Senior Community Benefits Specialist, and for the past almost 7 years in this role, have been part of a lot of our grant-making initiatives to our community on behalf of the health system. And in today's session, really looking at this new Baystate Medical Center request for proposals process that was launched last week. So really quickly to review if my little, there you go, slide will go next. If you haven't already, just to know who's in the room, again, if you want to add your name to the video or make sure it's reflective of who we're seeing, please ensure to keep your microphones muted for the majority of the presentation. And as always, I will make space for questions and then you can unmute and share. Until I pause in the presentation, I will ask folks to keep all questions in the chat. I have my colleague, Kimothy Jones, here with me today, who's going to be monitoring that. And Kimothy, feel free to flag a question if it's, particularly useful for me to maybe answer it in the moment. If not, we'll hold for some at the end. This presentation is being recorded, and the slide deck will be shared with all our registrants today. So if you want to just kick back and listen, you're more than welcome to do that. So our agenda. So I'm anticipating taking about 30 minutes or so, really going over this request for proposals from a big picture perspective, and want to make space for some questions. So just what we're going to cover in this time is, again, just an overview of the Better Together funding and some of the goals of this particular RFP, a high-level review of the application criteria and some resources for support for those who at the end of the day might decide to move forward with applying. There is also a little section on post-award, technical assistance and evaluation that is usually part of our Better Together grants. I'm going to walk us through how to access our online application. That tends to be something that folks get a little tripped up on, especially if it's the first time you're applying to Baystate. So we'll take some time to walk through that system. And then at the end, create some space for question and answers. And if at any time you can't hear me or I freeze, just let me know. So again, to restate our Better Together grants at Baystate Health, we have a couple funding streams, and the Better Together opportunities are episodic. We don't get access to this level of funding all the time. So we're really excited to share that we have this new pool of funding available for our area here. So big picture, the overall intent of these awards, they've traditionally been really focused on improving health outcomes. Again, traditionally been very outcomes-driven projects, looking at reducing health inequities, targeting social determinants of health, and really looking at intersectionality of how different influences of our health operate together. We really are interested in connecting hospitals and clinical care with public health systems, the community at large. Many of our proposals have sought to tackle really big systemic issues, looking at how they can have more impact, what we call upstream in terms of some of our health consequences and outcomes. And collaboration is really a marker too of our Better Together grants. We really try to push applicants to think about fostering collaborations between institutions, between public health authorities, other community-based partners, and even with your participants, right? How can we think collaboratively and develop projects that are really community engaged and driven? So this particular funding, for those who are curious, I won't spend too much time, but it comes out of a joint venture that we had to establish our ambulatory surgery center on 50 Wasson in Springfield. So it's a joint venture between New England orthopedic surgeons and Baystate Health. So the way this funding works is they establish a total value of this project, which in this case was $14.8 million. If a project is approved by the state, then they say, okay, 5% of the total value of this project, you will need to reinvest in what we call community health initiatives. For us, we name it our Better Together grants. And in this case, after taking off for administrative costs, evaluation, We also returned some of that money to the state for a statewide community health initiative fund. Many of you maybe have participated in those applications as well. We at the end of the day had a amount of about $486,000, and we had some leftover funding that we had, so we were able to bump that up to really round it out to be a total investment of $500,000 that will be focused in Baystate Medical Center. So I think I've seen a few faces pop into the Zoom room today that took advantage of some previous applications that we had in the past in 2021 and 2022. This one is a little different. So in the past, we were able to distribute those dollars across all 4 of our hospitals. This year, the Community Benefits Advisory Council at Baystate Medical Center, who really helped design this process, wanted to or agreed to keep the dollars hyper local, really looking at the Springfield community. So I just wanted to state that up front because I may lose some people, and that's okay. We're here to learn about the requirements and the goals and all that. So if you're used to our previous process, this one's a little different. So for 2024, we're really looking, and when I say we, it's the health system in collaboration with our community benefits advisory councils, which is comprised of community stakeholders and partners. They really wanted to look at advancing youth well-being in the Springfield community, as I mentioned, in order to decrease adverse youth mental health outcomes. So for our purposes, we're defining youth as anywhere from ages 12 to 25. So it trickles into that young adult age, recognizing that, you know, your problems don't end once you turn 18. So the group was really passionate about keeping an expansive age range there. And when we say youth well-being, you know, this is a statement we created, but it's not at all super complete. There's so much more we could add, but really looking to seek proposals that create environments, learning opportunities, programming for young people to thrive in their personal development, in their relationships, in their social connections, and overall sense of well-being, of belonging, recognizing that it's oftentimes those types of investments that are the most effective in preventing mental health outcomes that we don't want to see in our young ones. So that's a big picture statement. This Better Together RFP was really rooted, and I want to call it out here, the Youth Mental Health Roadmap for Western Massachusetts, which was previewed last fall. And, you know, as of January of this year, they have the formal report up on their site. So this was developed by the Public Health Institute of Western Massachusetts, which is a strong partner of ours here at Baystate Health. And you'll see that many of the learnings that came out of this roadmap, the CBAC really wanted to integrate into this request for proposals in terms of the types of strategies we're looking at, in terms of the just overall approach to working with young people and youth and their communities. So if you haven't checked that out already, I really encourage you to do so, especially if you are considering applying for this application. And another goal this year that's a little different than prior years is we wanted to attempt to diversify our applicant pool. So we recognize that not all organizations want to or are in a place to manage a full $500,000 budget, a full $300,000 budget. But if you give them, you know, a smaller quantity of money, there could be some really impactful change that can happen. So this year, we've decided to present the opportunity for folks to apply for one of 2 levels of funding, either a $300,000 award. So this could be you're looking to do a 2 to 3 year project that's super outcomes driven at the value of $300,000. Or we've also created an opportunity for 2 awards that we will be administering at the value of $100,000. And this is really looking to target folks that might want to pilot a new idea, maybe want to test an expansion. Maybe it's a planning project that you really want to take on, but you feel like this is a resource that you need to really lift it up off the ground and put some legs, under it. So those projects would be around 1 to 2 year investments. So I put that out there just so you can start thinking, which one of these levels might make sense for you. And I'll speak a little bit more later to like criteria and such. So again, the really big requirements are serving that primary population of youth between 12 to 25. And I want to say too, that doesn't mean that there aren't secondary populations or secondary audiences that your project might touch. Sometimes folks want to start a little younger. So maybe your project, really targets youth, but there's maybe a component that targets children younger than 12. Maybe your project wants to make some intentional connection with the parents and guardians of the youth. So although we're asking folks to present the 12 to 25 age group as your primary, you can also give thought to other populations of interest that might complement your work. Second, again, that geographic area of being based in Springfield, we want to serve Springfield youth as a primary catchment. With that, I will say, cross-town collaboration is something that we see all the time. So it's not an automatic no if your project potentially seeks to connect or link with other local efforts in surrounding towns. And also I wanted to share that serving Springfield youth doesn't mean that that an organization's physical address needs to be in Springfield, but just your project implementation does. So sometimes that's a question that has popped up. And third, the project proposal must align to one of the 4 strategies of focus that I'm gonna present right on the next slide. So recognizing again that mental health and well-being cuts across many sectors and disciplines. So although we're asking folks to kind of look at one of these 4 strategies in terms of their project development, we recognize and welcome proposals to think about, violence and injury and economic development and neighborhood revitalization, and how all these other elements to intertwine with what we see as mental health prevention and other ways that we try to seek to advance youth well-being. So those focus areas are outlined here. Again, I wanted to highlight the report. They're really pulled directly from this roadmap. And they're loose, we call them strategies. They're more sometimes topic areas depending on how you're viewing them, but hopefully we've presented some description. So I am going to read what each of the focus areas are. And we're asking folks to incorporate at minimum one of these strategies or approaches into your project. You can use all of them. You can use a mix. You can use just one. But this is what we are looking for. So in the area of destigmatizing and normalizing conversations on youth mental health, really looking for projects that have a clear focus on reducing mental health stigma and advancing youth well-being through creating, again, an environment, spaces, supports that allow youth to feel empowered to discuss their mental well-being. And you'll see that under each of these focus areas, we have linked some page references in the map just to dig a little bit deeper into the content if you want to see kind of examples of application, how that's been done locally. It's a great resource. The second is social connection. So seeking projects that have a clear focus of reducing social isolation by facilitating opportunities for social connection among youth and their families. Maybe it's their peers, it's schools, broader community culture, their place of living, looking really at that connectedness. The third is a little bit more formal. So it's social emotional learning skills building, which is a framework that has been developed. It's traditionally been utilized a lot in the schools, but also in a lot of youth development organizations. So this element, again, asks projects to consider incorporating this SEL framework and curriculum design as a means to equip youth with the knowledge, skills, and attitudes to support their emotional, behavioral health, overall well-being, productivity in school and in society. So one call out of the youth mental health roadmap was how can we pull, the SEL skills building elements that have traditionally been found in schools into different spaces, into new spaces, innovative spaces. So that's one of the elements. And the last one is social media. And as we know, social media, when in discussion in relation to mental health, is seen as a positive to some, seen as a negative to others, seen from both perspectives. So when we say we're looking for initiatives to look at social media, we're looking for projects that can either leverage social media as a strategy, as a tool to foster a healthy view of youth mental health, but also at the same time considering education and coaching, mentoring around its harms as well, or just broader kind of access to technology and how that can either serve us well or serve us in not the best ways, depending on how we engage. So that's another tool. So think about campaigns, think about youth informed, advocacy, things like that. So those are the 4 areas, and forgive me, I know I'm moving a little quickly. But just to jump to kind of the key dates and timelines for folks, we're looking for proposals to be submitted. It's in here, the first highlight in yellow, by Wednesday, March 27th. So we are calling that our round 1 application. And what we mean by that is it's the heaviest writing lift that we have. So the bulk of your responses and kind of the presentation of your project idea will be administered through this round 1 application due in March. To help folks prepare for that, highlighted in blue, in years past, we had a few feedback panels that we offered. We had some office hours for technical assistance. This year, we're kind of packaging those opportunities as one. So myself and my colleague, Timothy, who is helping me in this, have reserved Mondays from 11 a.m. to 1 and Fridays from 12 to 2 as office hours that folks can sign up for. It could either be a technical question like, hey, I'm having trouble accessing, this form. It could be, I have this idea, what do you think? You could approach us maybe with project partners and say, are we headed in the right direction? And our hope is that you're able to take advantage of these office hours up front to really see if this opportunity is the best one for you. And also to help ensure that we can coach you in the criteria so you can present your best foot forward. So after March, we have a time of review, obviously, and scoring. Then we will be notifying folks if they've moved on to a finalist round in hopefully early April. With our finalists, we do ask for some additional documents as part of their submission. So that's sort of the round 2 that we discussed, but it's not as much of a lift as your initial round 1. So folks hopefully will be informed by mid-April with final round interviews that have been virtual thus far. If folks really want it in person, maybe we'll do that. But for right now, it's virtual during the week of April 22nd through the 26th. So for folks who are really serious about applying, we're asking you to just try to keep these dates open as much as possible, recognizing that they're subject to change, but if you can hold them, that'd be fantastic. And the goal is to have funding decisions on or before May 31st. And I say that just because the recommendations for funding need to go before our Community Benefits Advisory Council and our Baystate Medical Center leadership. So from beginning to end, March 27th, hopefully folks will submit, their interest and application with May 31st notification. So that means during the month of June, we would really, go out to present a public announcement and start engaging our grantees with post-award kind of responsibilities. So again, office hours, just to highlight them again, they could be used to discuss questions related to our grant guidelines, application, receive feedback on a preliminary idea. But I just want to emphasize again, the value of utilizing these office hours. It's really encouraged just to ensure adherence to our grant criteria. So if you can pop in, even if it's just to say hello, so we know you're interested, that would be amazing. And to sign up for a slot, we're allocating 20 minutes at a time. You can email me and I will put you into one of those Monday or Friday afternoons. And again, noting that dates are subject to change. So if for some reason we cannot accommodate you one day, but I'm able to make space a different day, I'm more than willing to do that as well. So criteria, I'm not going to go into each of these in depth. Again, I really recommend you read the grant guidelines. And I'll present some of the other resources that we have for you to really dive into the criteria. But essentially, these criteria translate almost one for one to a question in the application. It's not perfect, but essentially, if you see a criteria named here, there's most likely a very specific question tied to it. So for us, again, we're really looking at how are you aligning to the focus strategy in your primary population? You know, does it seem superficial, or did you really give some deep thought in terms of that alignment and engagement? We're also looking at intersectionality with other social determinants of health. So, you know, what are other ways that you are looking to help advance a young person understand? Maybe it's their education, maybe it's issues around violence in their community, perhaps it's how to create safe places to play, you know, just putting it out there, but really looking to see how folks have gotten creative around intersectionality. Evidence framework is looking at what you are describing in terms of the criteria that you feel makes your project feasible and as a potentially successful in this area. So some initiatives have been very rooted in a framework that has been tested and kind of proven to be effective. Others might have a promising practice, so there's space for you to talk about that. Feasibility and impact, again, just really looks at your reach in the community, your, I don't want to say your reputation, that's not the right word I'm looking for, but kind of what is your relationship to community that really can make us feel confident that this is feasible, that your idea is realistic, that you're going to go out there and hopefully make the impact that you've described. So there's some space for that. And in conjunction with that is this idea of community support and engagement. You know, who have you connected with thus far? Are you a newer organization? If so, that's totally fine. Tell us how you anticipate engaging with community to inform this project idea. If you're a longstanding, you know, staple community organization or initiative, tell us what your history has been and why you feel like this new project is going to be received well. Cultural humility and health equity are two other areas that we ask about in terms of your approach in your project, but also we ask about cultural humility from an organizational perspective. So asking folks to really think about what are your cultural, you know, what are your practices? What are your cultural norms in your organization? How might that translate in terms of impact of this project on community? So we ask folks to be very reflective there, and similarly with health equity. Partnerships and collaboration. So this in the past has been, the last round was a requirement. This time it is not a requirement for applicants to formally partner with another organization, but if you are, we do have some additional questions for you in terms of, you know, how roles and responsibilities will be laid out. How do you see each of your organizations, you know, carrying out their unique roles, but also working in partnership, etc. And then the last is looking at policy systems and environmental change. So again, this is a newer concept that we introduced the last round of Better Together funding, and is something that we're interested in learning about in terms of how our organizations doing their best to continue pushing more upstream in terms of their work. If that's a new term for you, the grant guidelines has a ton of resources around the definitions and some examples. So I don't want to get too in-depth here in the information session, but we ask folks to think about, you know, is there a component of your project that can test out going more upstream? Or maybe your initiative is very focused on systems change, and, you know, it's the essence. So we want to learn about that there. So again, I read the grant guidelines. I can't say this enough. It's your best tool for immediate questions and understanding. We put some good, you know, thought into providing information here, but it's not perfect. So if after reading you're like, hey, Brittany, I'm so confused about this element, always here to help. So in addition, we have an online resource library that is also linked in the grant guidelines, that are webinars that we've previously hosted and recorded and archived, for folks that might want to go deeper into some of these topics. So if you are like cultural humility, I'm not familiar with that, you can read the content in the grant guidelines, but we also have some videos accessible for your viewing. We also have videos on how to access websites for evidence-informed programs. Like if you want to learn more about the data piece and how to defend, a project idea, we have a webinar on that as well. So the listings are here, and I've also put the link in the bottom right corner when I send this out for you to go directly to the page of the online resource library. So that's the bulk of what you'll be kind of writing about in round one. And then round two, again, it's going to be a virtual interview. And we recognize that sometimes writing isn't a person's strongest suit, right? Maybe you don't have a grant writer on board. Maybe you just do better talking and having conversations. So in our round two virtual interviews, a couple things we're looking at. One is you will be asked at this time to develop a more formal work plan. So do you have a promising work plan? Do we feel like it's feasible? We'll also ask for a presentation of a budget. So again, looking at how realistic is it? How do you cost share with other organizations? How are you potentially stipending youth or community members to engage with you? We also ask about an evaluation plan. So we consider, how thoughtful are you in asking questions around how you will test the effectiveness of your initiative, how it's being perceived by community. We don't expect this evaluation plan to be perfect because we do offer support post-award as well, but we want to get a sense of like what's important to you, what are the questions that you would want to ask. And then we look at passion and innovation rate. That's something that comes out when you speak to someone more so than in writing sometimes. So we look at that element. It's more subjective, but it's there, and also strength of concept. So decision making. We have a grant review team that gathers together. It's made up traditionally of about 7 to 10 members, 4 to 5 from our Community Benefits Advisory Council. We usually recruit another 3 to 5 from local community members, volunteers. We've had youth in the past serve as well as reviewers. So when we score, your round one application does get a numerical score, but that is not the be all end all. We tend to discuss in conversations and make decisions by consensus in terms of who moves on to round two. And I will say in this red sticky note up top, as I mentioned earlier, we have 2 lines of funding levels, the outcomes and the pilots planning. Both will be scored using the same criteria. So you should anticipate you're going to be asking the same question, answering the same questions, but you will be weighed against your peers. What does that mean? We are going to be looking at all the outcomes-driven projects and comparing those and deciding who moves forward to a finalist round. And then for those pilot planning applications, that cohort of applications will be looked at together and then decisions made in terms of who moves on. So hopefully that just reassures you that you're not going to maybe get outshined or something by someone else because they have a maybe more lavish budget. It's not. We're trying to be equitable in terms of how we're reading and viewing and scoring. So I just wanted to name that. And at the end of the day, as I mentioned, these reviewers will present recommendations to the CBAC and our leadership at the hospital. And in my role, under the Office of Diversity, Equity, and Inclusion, we really serve as process facilitators. So I do not score. I do not give my personal opinion. Timothy, who will be helping me, will be doing the same. We really want our community to make this decision as much as possible. So one more slide, I think. Yes, and then I'll pause. Post-award. So what should you expect? If you were to move forward all the way to the end and say, yes, you have received a Better Together grant, sometimes people like to know upfront what to expect. So In the past, we have contracted with Public Health Institute of Western Massachusetts to provide evaluation and technical assistance. I put their logo there. And in the beginning months, you'll have some initial phone call with a TA provider to identify what your TA needs might be. Some folks have a lot that they want to work on. Others are a little bit more established, might not need as much help, but it's a great check-in for them. During your first month, you'll have a consultation meeting again to go deeper into what your work plan is, your budgets, finalizing and refining maybe other key documents, planning documents that might be unique to your proposal implementation. But you'll get around, 1 to 2 months in the upfront time, a lot of one-on-one connection with a TA provider. Then afterwards, that connection turns normally into a once a month, some folks once every 2 months, check-in with your provider. And then there are a couple other post-award requirements that we invite folks to engage in. One is we have an annual community of practice session that we host with our Better Together grantees, just to continue kind of your professional development, your connection and engagement and networking. So we do have that as a requirement as part of this RFP. And last is we do have a community benefit forum that Baystate Health also hosts every year that we want our grantees to be engaged in, as well as presentations to our community benefit advisory councils at minimum once a year. So the grant guidelines, again, has the full presentation of what these post-award requirements are, but I just wanted to call out some of the few, because a few of them in the beginning. Whew. For those who do not know, I am expecting a baby, so I am out of breath. I am going to pause. Timothy, if there's anything that's popped up in the chat, and if there are folks that have, a question that might be that's maybe not hyper specific to you, but might be worthwhile the group hearing, I can also make space for that now before I transition.
Okay. There was one message directed to me asking what the initials or acronym SDOH was. So that is social determinants of health. And I think maybe 3 slides back when you were talking about the videos that are archived, there's a link. Can that be put in the chat so everyone can just go directly to it by any chance?
I would need to stop my screen share, but
wait, I'll do it. Hold on.
You got it? All right.
1 second.
Yeah, no problem. While you're doing that,
Ben has his hand up right now as well.
Go ahead, Ben. Hi.
Thank you, and good morning, good afternoon, and thanks for this presentation, Brittany. People who apply for grants are super helpful to hear from the grant makers about what they're looking for. I have a very specific question, but I think it might apply to everyone, which is in the context of cultural humility, will the composition of an organization's staff and or board of directors, as far as evaluating on diversity, equity, and inclusion, will that be a factor in scoring applications? Thank you.
It's a great question. The short answer is yes, but when we say yes, what we mean is we're really looking to understand what an organization's journey is. So sometimes organization's board isn't as diverse as what they would hope it to be now, or in the past, there's been a leadership representation that isn't reflective of the population served. So we recognize people are coming from different spaces. What we want to hear when we're asking about cultural humility is, where are you in your journey of self-reflection? Are there any new goals that you have as an organization to increase your diversity and ensuring that it's reflective of the population that you're serving? And that goes for race and ethnicity often comes to top of mind for folks, but language, education status, lived experience, those are the kinds of responses that we're looking to get when we say that we're scoring on it. It's really on understanding an organization so that we can feel confident that, if you are a predominantly white organization serving a community of color, that can happen. We see it all the time, but how are your practices translating? And we want to make sure that the population at the end of the day feels like they're being looked at from an equitable perspective, with cultural humility, with respect, and genuine, authentic engagement. So hopefully that was helpful. Happy to talk more if you have a specific question related to your organization. All right. I will move us forward. This is the piece that gets a little boring, I will say, which is our grant management system and accessing the online application. So I'll do my best not to move too fast, but also keep us moving forward. So I have a couple screenshots that I've embedded in the presentation. I will be, I think I'm getting feedback from someone. Hold on. Okay, I will be noting that where to find our application, and please recognize that nothing, but all applications must be submitted via the online system. We can't receive hard copy applications, unfortunately. Something being mailed to us, we need to receive it through the online system. So I just want to name that. And as always, technical assistance is available if you get stuck. So Timothy, maybe this is a link that you can also put in the chat, baystatehealth.org/apply for funding. That brings you to our main page here that presents an overview of the Better Together grants, and as shown in red, provides also a description on the current fiscal year 24 opportunity with a link to the grant guidelines. It's very teeny tiny down here in blue on the screen. But if you visit the page, you'll see that the grant guidelines are hyperlinked and you can open the PDF there. I also have a direct link to the grant guidelines at the end of this presentation, if that's helpful. So when you go on this page, there's a lot of description on the Better Together grants. And if you scroll down, the very bottom, there are two green buttons. There's one that says see funding opportunities. So again, if you just wanted to get high-level description of this funding opportunity, you can click that without having to sign into the system or do anything of that sort. But if you're kind of ready to move forward with an application, you'll want to click the green request funding button, and that takes you to this landing page. So this is our grant management system. We call it Foundant on the back end, not fondant like the like the cakes of Foundant. Many of you have used this, some might be new. So if you are new to our application system, you can create a new account with your organization's tax ID, etc. If you're a returner, you can just log in with your existing credentials. I tell folks, if you get here, bookmark it, bookmark it, bookmark it, bookmark it. I think Timothy and I get at least, 3 emails a month that says, what's the link to that page again? Which is totally fine. We'll always respond back. Okay.
It's working.
So I'll move fast. So once you log in, you'll enter into an applicant dashboard into our system. Hopefully you didn't miss this note about bookmarking this page. You'll log in. There's going to be an apply button at the very top. I've circled it in red. You'll click there. That will bring you to this description. So this should pop up immediately on your screen. Baystate Medical Center fiscal year 24. Better Together grants has a high-level overview. If you're interested in looking at the questions before you kind of dive in, you can click a preview button with the little eyeball at the bottom left there to preview your application questions, what they are. If you're ready to move forward, you'll click apply a second time. It's highlighted by the red circle up top. And then that'll bring you to a new page that is titled LOI. Unfortunately, the system doesn't allow us to kind of change the labeling in this system here. So LOI does equal our round one application. So if you see that, you are in the right place. I won't show it live, but if you scroll down, you'll see the ability to now input questions, responses into those questions. And also wanted to highlight that there is a question list that you can download as a PDF. So the previous screen, you just preview it in the website. The second one, you can actually download the PDF of questions if you wanted to discuss them with your colleagues before advancing. So that was it. Again, it can get a little bit confusing for folks. So Timothy and I are here in terms of navigating that applicant dashboard. So communication moving forward, again, the session is going to be shared and posted on our website as well as sent to you via email. If you have any questions on grant guidelines, applications, you can email me and my secondary support. Very happy to share Timothy Jones, again, from Baystate, who you can also see seeing some communication. So if I can't get to you for whatever reason, if I'm out, Timothy will be your second support. And then lastly, this is just some key links again. So this brings you to the Baystate Apply for Funding page. To start round one application brings you directly to our grant management system. The grant guidelines are linked here as a PDF for easy downloading. And then the Youth Mental Health Roadmap page is also linked here for folks who may want to use that as a complement. So that is the bulk of the presentation. Happy I did not freeze again. I will stop my share. And if folks are feeling confident, like they have what they need, you are more than welcome to sign off. Thank you so much for joining. If you would like to stick around and hear kind of what questions are being asked and my responses, you can do that as well. Just want to create some space for folks in the room. All right. And thanks, Sarah, for your words of kind of support here. Internet. That's a nice plug, Timothy, for the Alliance for Digital Equity at Baystate Health and helping us resolve all our internet issues. Yes, Ben, I see you have another question.
I feel like the new guy here. I got all the questions.
It's okay.
To be clear, there's only 3 awards going to be made, 1 at the pilot and 2 at the, okay, no partial awards?
No partial awards. We did that a few years ago. We had some pros and cons. So we found sometimes people like to know what they're designing for. So that is the approach that we're taking this year.
And how many applications are you expecting, roughly?
It's a great question. The past 2 years for Baystate Medical Center's catchment area, we've seen anywhere from 40 to 60 applications. This RFP is a lot more focused, so I anticipate that pool might decrease. But that it has been, I'm confidently in the 40s, early 50s.
So we're looking at somewhere between 5 and 10% acceptance rate.
Ask the grant reviewers who end up reading. We try our best to really give everyone the attention that they deserve, because you put a lot of time into it.
Right. So
yeah.
I mean, small organizations like mine that don't have professional grant writers need to evaluate, are we going to invest the 20, 30, 40 hours of grant writing for a 4% chance of getting it? You know, am I thinking it right?
Yeah.
Yep. Okay.
Well, we want you to is the short answer, but we really do. We've been trying, like I said, a goal to diversify, and we love those that we've been able to fund in the past and partner with, and are willing to explore that opportunity again for folks. So we also want to get to know other organizations and see what else we might not have been able to invest in financially before. So I will, if
Can I interject really fast, Brittany? Sorry, I know this is
sure,
another game.
Amber.
Ben, you also just make me think, I think there's room for partnership too. You talked about partnership during, and I don't know if there's any space for folks to get together if we want to talk about our projects and maybe ways that we could partner, but I think that might be a good idea. Like for instance, my agency, Ben, we do have a grant writer, that's me. So it might be worthwhile to look into partnering with an agency. Just a thought, because that was something that you mentioned being a priority.
That's excellent call out, Amber. Thank you so much.
And if I may very quickly, if this helps, Ben, I'm fairly new to the whole grant writing process myself, even though the city library's done grants before. I'm baby grant right now, so I feel your pain. But one of the things I've realized kind of working on the project we're trying to work on here is that the grant work can go forward. So if we apply for this grant, for example, and we're not one of the ones that are selected, we save that work, we look to see what else is out there, we adapt that work that we've already done for this grant, say, for another one. If you ever want to stop in the library, we'll be more than happy to find other grants that might apply to your situation, but the work's never wasted. You can always move it forward, even though, you know, that particular round might not go to you. So that's helped us a lot in the past, if that helps you.
Yeah, I appreciate both of you chiming in. I think that's both spot on answers. And I was going to offer similarly, sometimes I hear, you know, some folks are like, I really want to apply, but, and then I hear someone else that said, really want to apply, but, and we do try to connect folks. You know, we ask obviously your permission to share that you're interested in applying with other organizations, but that has been something that we've tried to do so that there can be that cross collaboration and confidence moving forward into the application cycle. And I can also keep you folks surprised, right? You can email me and be like, hey, Brittany, like, you know, realistically, how much interest have folks been expressing? And I can kind of help gauge what we're seeing in maybe, you know, into late February, early March. So if that will help kind of inform your decision. Any other questions, comments? Okay. I would like to thank Luz Lopez, who's joining. I see you here, Luz. She is the co-chair of our Baystate Medical Center, CBAC, longstanding community member advocate as well, but who helped us design this. And Anna Marie Golden, I see here, who is also a colleague of ours at Baystate. And I did see my boss, Dr. Tyann Hinson, who is the Senior Vice President of DEI at Baystate Health. So just want to acknowledge that there's a lot of leaders in the room, and we're looking to partner with you if this isn't the right opportunity. We would just love to continue getting to know you as Baystate and seeing how else we can partner and collaborate. So I just wanted to put that out there as well. All right. Well, I will stop the recording and stick around for another minute or two. If not, have a wonderful rest of your afternoon. And thanks for joining.
Thanks so much, Brittany. You did a great job.
Thanks.